My next guest faces the breast cancer battlefield every day with her patients. Jackie Miller is a nurse navigator with Virtua Fox Chase Cancer Program Center for Health and Wellness, and she's here with us now to share how she's helped support and educate her patients about this dreadful disease with advice that can help reduce our own risk of breast cancer. Welcome, Jackie. How are you?
Thank you. Thanks for having me on the show.
It's wonderful that you're here, and it's Breast Cancer Awareness Month, and we're doing so much, and you do so much as a nurse navigator. What's your role?
Well, nurse navigators are oncology nurses that guide patients when they're originally diagnosed with cancer through their treatment journey with support, with educational resources, and also just a hand to hold on to get you through the entire system.
So what do you think from your experience in working with these patients and their families, what do you think they need the most when they first come in and get that diagnosis?
Well, they need education on what their diagnosis means, and also they need to know what their treatment options are. They also need a lot of emotional support because the information is fast coming at this point.
Right. And scary too,
very
right?
frightening. And most patients have a lot of questions about what does this mean for my entire life, and so that's what we try to help them with, to guide them through the treatment process and support them along the way.
So who provides the emotional support? Do you have a team that does that?
We do. We have a team, everyone from the oncologist to the nurse navigator to our counseling services that we have provide that support to them every step of the way so that they feel that they are supported and they get through their treatment.
Great. So for all of us who are females and our families, what is getting a mammogram just once a year? Is that enough? Does that take care of it? What do we need to do?
Well, the first thing all women need to do is be familiar with their own breast, and certainly.
And don't be uncomfortable about that.
And don't be
right?
uncomfortable.
Or shy
right.
about that. It's your own breast.
Right. It's your breast. You need to know them, and you need to know any changes. And when you have changes, you need to report that to your physician. That's the most important thing. There are also clinical breast exams by your physician or your nurse practitioner, and the American Cancer Society recommends yearly clinical breast exams as well as yearly mammograms for women over the age of 40, and that's women of average risk.
So what's the difference?
Well, if you have a mother or a sister who's been diagnosed with breast cancer, you may be in a higher risk category, and that's something you need to talk to your doctor about because your mammograms may need to begin earlier than age 40.
Okay, and so is that part of the screening process? What's involved with screening?
Well, the screening process is to take a family history, to know who in your family has breast cancer or any cancers, what your personal history is. They would do a clinical breast exam, and then you would go for the mammogram to be evaluated.
You know, it's important because a lot of people aren't getting that information in terms of their family history, and for not just for breast cancer, but for many different diseases, it would be important to have that information so that you can report that to your physician to help you, whether it's getting more screenings or testing, right?
It is important to know your cancer history of your family, and not just your female relatives, but also your male relatives. We do know that some cancers intertwine, so it's important that you know the history of all of your relatives.
Good. What would you say to women who are not doing that? I mean, how do we are we educating people in the community? Do you do that in your role, or is it just dealing with the patients that are coming in?
Well, we do that. We do some outreach, and we talk with young women as well as all women to determine and discuss their mammography scheduling and to encourage them to get annual mammograms. But I think you're correct. I think a lot of women do not know, or they do not want to get an annual mammogram, and so then it becomes a little bit more difficult if you are diagnosed with breast cancer, because then your cancer may be more advanced, and when we look back, it may have been something we could have caught earlier had we had that earlier mammogram.
Now, women who are getting older, sometimes I hear that they're not going for their annual exams because they think, oh, I haven't had it in so many years.
Right.
But they're still at risk, right?
They are, and again, that is something you need to talk with your doctor about as to when you personally cannot no longer go for a mammogram versus you need to keep going.
So is there any age cutoff, or?
That's really specific to each patient as to if they can, stop getting screening at some point or they should not. And that's really something that your doctor would guide you with.
What do you find is the most rewarding aspect of your job, Jackie?
The most rewarding thing that I do is to be that support person along the journey. And when people tell me that I'm making a difference, that they're glad I was on the other end of the phone, things like that, it means a lot to me.
Good. Can you tell us a story, something related to that a little bit? A real quick story or just something that comes to mind?
I have had a patient who recently was diagnosed. She had a lot of social barriers to getting care, and every time she would come in for chemotherapy or her radiation treatment, she would ask the front desk, "Where's Jackie at? Is Jackie coming today? Is she here?" And they would call me and say, "She's here, come on out," and whatever. And we really formed a very strong bond throughout her treatment. And even now that she's done with her treatment, she'll still call me and say, "I didn't have to see it today, but I just wanted to say hi." And I think that means a lot to me.
So,
Yeah.
so you gave her the solace and the support she needed.
Yes.
Thank you so much, Jackie. When we
you.
come back, Jackie will tell us about some of the newest advances in the treatment for breast cancer. So